A new medication for treating benign prostatic hyperplasia, Silodosin. A revolution or more of the same. Hi, I'm Dr. Tiago, a urologist here in São Paulo, where I see patients in person at my clinic, Triumph Clinic, and also online for all of Brazil. This week, several of my patients came to ask me about the new drug, Silodosin, which has appeared here on the Brazilian market for treating benign prostatic hyperplasia. Yes, it's a welcome drug, but it's not a new drug. This drug has been approved in the United States since 2008, okay? And that's where the mechanism of action of this drug comes in. It doesn't have a new mechanism of action. I'm going to show you a little picture of the prostate so you can understand. We have two main groups of drugs for treating benign prostatic hyperplasia. 5-alpha reductase inhibitors, finasteride and dutasteride and alpha blockers, Doxazosin, Tamsulosin, and now Silodosin here in Brazil. What's the big difference between them? 5-alpha reductase inhibitors, finasteride and dutasteride, act on one of the mechanisms responsible for benign prostatic hyperplasia, which is the increase in the dihydrotestosterone to testosterone ratio. So these two medications serve to try to reduce the size of the prostate or at least prevent growth, right? Now, alpha blockers, which are Doxazosin, Tamsulosin, and now Silodosin, act on this musculature around the bladder right at the exit of the urinary tract, making it relax more easily, improving urinary flow. So the inhibitors, the alpha blockers, are responsible for short-term symptomatic improvement. That's why we often combine the two medications. One to try to reduce the size of the prostate, which is long-term, and the other so you feel an improvement in the urinary pattern right away, right? In fact, there's a test down here that I created for you to try and see what the level of your prostate symptoms is. It's an internationally validated test for you to see if everything's okay or if it's better to seek help right away. The link is down here in the description. It's free, okay? Don't forget to do it. But getting back to it, when we talk about Silodosin, you've already understood that it's an alpha blocker. But now pay attention here, come with me. What's the big difference? So I have three, Doxazosin, Tamsulosin, and Silodosin. Which one is better? Look, in terms of efficacy and improving symptoms, all three are the same. Doxazosin, Tamsulosin, and Silodosin. If you're not taking anything today, trying one of the three, the symptom improvement will probably be the same for all three, right? The difference is selectivity, and that's where the side effect issue comes in. People often say to me, oh, Silodosin has fewer side effects. I say, it depends, because the side effect profile, in fact, is what changes. This selectivity, it depends on which receptor it blocks. We have two types of alpha receptors, alpha 1A and alpha 1B. Alpha 1B is more present in the muscles of the blood vessels and alpha 1A in the muscle that's in the prostate. Doxazosin is what we call a non-selective inhibitor, so it blocks both. And that's why Doxazosin is one of the alpha blocker medications that most causes dizziness and hypotension, a drop in blood pressure, because it also blocks the alpha receptor of the blood vessel. It relaxes more, blood pressure drops, and the person ends up having this side effect of dizziness and malaise sometimes. Tamsulosin, it's already more specific to the receptor that's there in the prostate. It's not purely specific to the prostate. It has a higher selectivity, but it also has some degree of blockage there in the blood vessels. That's why dizziness also happens in these cases, but just for you to compare, the incidence of dizziness and hypotension with Doxazosin is around 20 to 25%. For Tamsulosin, this is around 4 to 5%. And then came Silodosin, which is even more specific than Tamsulosin for the prostate. And so it has an improvement in this pattern of the dizziness side effect. Oh, doctor, so does that mean Silodosin has fewer side effects than Doxazosin? When we talk about dizziness, yes. Now, there's a side effect that many men complain to me about the medication, which is retrograde ejaculation. The more selective for the prostate, the higher the chance of retrograde ejaculation. So just to give you an idea, Silodosin causes hypotension in less than 2% of cases. Now, it causes retrograde ejaculation in more than 25% of cases. Doxazosin causes very little retrograde ejaculation. See that I usually say it's an arrow, right? Doxazosin on one side and Silodosin on the other. If we put hypotension up here and retrograde ejaculation down here, Doxazosin will have a high degree of hypotension, a low degree of retrograde ejaculation. Silodosin, a low degree of hypotension and a high degree of retrograde ejaculation. So answering my patients' questions here, is it worth switching? All my patients were adapted to the medication without major side effects and doing very well from a symptom standpoint. No, it's not worth switching. Simple and direct. Now, if you're starting treatment now, you've already tried Tamsulosin, you've already tried Doxazosin, and dizziness is a side effect that prevented you from following the treatment, we can try Silodosin, right? Now, I want a medicine that gives me less retrograde ejaculation. It won't be Silodosin, right? or I already have a surgical indication. Silodosin won't take you out of the surgical indication because it won't improve the efficacy. In terms of treatment, in terms of the efficacy of symptom improvement, the three are practically identical. Got it? I hope you've understood once and for all where Silodosin fits into the treatment of benign prostatic hyperplasia. It's not some revolutionary treatment, it doesn't have any new mechanism of action, but it is indeed important for those patients who have dizziness. We can use this new medicine to try to reduce this side effect, which sometimes ends up preventing treatment for some men. I hope you enjoyed this video. Don't forget to like it. It's very important that you subscribe to the channel so that the channel keeps growing and I keep recording these videos here for you. That's all. I'm Dr. Tiago and see you in the next video.